Hi, I'm Dr. Robbie Goldstein, Commissioner at the Department of Public Health. We're hearing about rising COVID-19 cases in the community, and we're seeing hospital admissions starting to climb. Many of you may be thinking about COVID and other respiratory viruses. I'm here to tell you what we know at this point in the season and to remind you of what we've learned about COVID and about respiratory viruses over the past 3 years so that we can protect ourselves, our communities, and those we serve across the Commonwealth. During the past few months, we have had incredibly low levels of COVID-19 activity, much lower than we experienced last summer or the summer before that. We should expect to see these fluctuations in activity. In the past few weeks, COVID-19 activity has increased. To better understand how COVID and other respiratory viruses are impacting our communities, we are looking closely at all of the available metrics, including test results, wastewater surveillance, and hospital admissions and bed capacity. All of these markers have been increasing week over week, but they remain much lower than they were at this point last year. How we think about and manage COVID and other respiratory viruses will be different this year than in prior years. We know much more about COVID now, and we know how to protect ourselves. Vaccination remains a key way to protect against severe disease, hospitalization, and death. And while the COVID vaccine gets the most attention, it is important to remember that we also have vaccines against other respiratory viruses. Everyone 6 months and older should get a seasonal flu vaccine, and for the first time, this year there's a vaccine available for RSV for newborns 8 months and younger, as well as for people 16 older. In addition to vaccines, we have treatments available for COVID and flu, which are most effective if they're taken right at the beginning of illness. And COVID prompted improvements in air quality and ventilation in many buildings and spaces, and these measures will decrease the risk of respiratory virus transmission when we're inside. With all of these tools, this is going to be a different kind of year than what we previously experienced. Will we see COVID cases increase at points through the fall, winter, and spring? Absolutely. But we'll also be able to prevent a lot of illness, hospitalizations, and death. In the coming weeks, the Department of Public Health will launch a health promotion campaign to inform people in the Commonwealth about the benefits of vaccination and the ways we can protect ourselves from respiratory illness. We'll have a particular focus on those individuals who are most vulnerable to disease, those who are older, and those who have underlying conditions, including weakened immune systems. I encourage you to talk with clients, program providers, colleagues, friends, family members, and communities about the benefits of vaccination and how to stay safe and healthy. If you'd like more information, please visit www.mass.gov/dph/COVID, where we'll keep you updated with information, not just about COVID, but also about other respiratory viruses. Thank you.